All right, but
I am not in a single person pair as a male. I will never have one.
But is it safe to assume that there may be a woman out there who's also not married, who doesn't have kids, who believes that she shouldn't have to pay for you to get a prostate check or a screening for testicular cancer because she's never going to have any of those ailments and she's not invested in men just as you're not invested in women? Is that correct?
Women can have prostate cancer.
Okay, but let me ask you this.
It is a very low occurrence, just like males having breast cancer.
But this is no different than non-smokers who are out there who feel they shouldn't have to pay higher premiums because of all the medical care for smokers with lung cancer. It can go on and on. But see, this is no different than auto or homeowners insurance. I don't have hurricanes.
It is different. It is different.
It's not different.
In auto insurance or homeowners insurance, if you're placed into a high-risk area, whether it be you're a drunk driver or you've got multiple accidents or you've got multiple speeding tickets, you are placed into a high-risk pool.
Right, but I don't have hurricanes in Tennessee.
If you're a smoker, you should be put into a high-risk pool and have to pay more. I've got no problem with that. My problem is that when I am being forced to buy insurance that I, one, will never need, or two, never want it.
It's no different than auto and homeowners insurance. I don't have hurricanes here in Tennessee, but my rate will go up as the insurance company has to pay for the hurricane damage in Texas and Florida. I'm a safe driver. I have no accidents, but my rate will go up as the insurance has to pay for people who have accidents. The people in these groups are both men and women. They don't pay for what has already happened to them. They pay for what could happen to them. That is what it means to be insured.
What I'm talking about is not group insurance.
Right, but no company is only going to insure you. Okay, they have to have a group. They have to have a group, and all the people in this group are going to pay into that fund. And the insurance company makes money when more comes into the fund than they pay out.
At that point, the insurance company charges you what they feel they need to charge you for them to be profitable, or for them to at least stay above water. I agree to that rate, but I also tell them this is what I want. These are the insurances I want. I want the insurance. And you no longer have that choice under the Affordable Care Act. There are no more policies that are catastrophic policies anymore.
Okay, well,
if I wanted a catastrophic policy, I can't get it anymore.
Now, you don't like paying for their birth control. Okay, you've said that a couple times. Do you think women like paying for your vasectomy, or they like paying for your Viagra prescription? But you can't pick and choose what's covered because you're a man, because there are going to be women in the group. The group has to have men and women. It has to have thousands or hundreds of thousands or millions of people in it in order to generate enough money to cover the payouts for all the insurance costs.
But here's the difference. I choose to take Viagra. If I don't take Viagra, then I cannot, or I possibly cannot perform sexually in bed. Okay?
Right, but your Viagra is covered by your health care. Your health insurance covers Viagra, but yet you don't want a woman to have her birth control covered.
In my opinion, Viagra should not be covered.
Okay, should your vasectomy be covered?
Yes, my vasectomy.
No, wait a minute. That's an elective. Hold on. That's an elective surgery. Why should that be covered? Isn't that birth control?
But I also am advocating that women, if you're a single woman in a single plan, you're not going to be charged for vasectomy. Okay, or the possibility of one, because you'll never have one.
Here's the thing. I can tell you're not heavily invested in women, so that's affecting your.
You're saying I'm not invested in women, which is totally false.
But yet you've consistently said you don't want your plan to cover mammograms and pap smears and things of that nature. So I'm simply saying.
You're right. I don't. And that's because I, as a person, am never going to use it.
Okay.
There's no way possible I will ever use it.
Right, and they will never get testicular cancer, and they will never need Viagra.
again, I already stated, I don't think I should that anybody should ever be insured for Viagra.
Well, let me tell you this. I'm invested in women, okay? Now just hold on a second. I'm invested in women. You're not. I am. I lost a grandmother to colon cancer at 47 because she wasn't screened. I lost an aunt also to cancer at 47 because she wasn't screened. And I don't want my wife or my daughters to die because they can't get screened because their screenings weren't covered by my insurance. So here,